So, when you're kids, you just can't wait to get older, but little do we realize the growing pains. And one disease that can affect anyone at any age is arthritis. That's why we've got Dr. John Rowe and his team at Paris Community Hospital to help us manage it. Thanks so much for hanging out with us again.
You're welcome. Thank you.
All right, so arthritis affects anyone at any age, like I said. How is that?
It can, but it's very unusual in kids and younger people. The most common form of arthritis is what we call wear and tear arthritis, which implies that as we get older, some parts begin to wear out. And that's exactly what arthritis is actually wearing out of our built-in anti-friction device in our joints, which we call cartilage. If you break a chicken part at the joint, it's real white and shiny and smooth. That's cartilage. It's actually the slipperiest surface known to man. Arthritis, plain and simple, is damage or the wearing out of that cartilage surface. Now in kids, if they have arthritis, most often that's going to be due to what we call an autoimmune disease such as rheumatoid arthritis, where the body gets a miscue and actually perceives its own cartilage as being abnormal and begins to destroy it. But a lot of the arthritis that I deal with in older individuals does start in kids when they injure their knee or their shoulder playing sports. They tear their anterior cruciate ligament. There's oftentimes some associated cartilage damage, and over time that will speed up the wear and tear process, in which case as they get a little older, they may start complaining that their joints ache and they can't do quite as much as they used to.
And those aches aren't very pleasant, but they are manageable. You've got some tools to help people living with arthritis. So we've got the first one, activity modification.
Absolutely. One of the things I have to explain to people is we don't have a way to put new cartilage back in the joint. So I explain to people kind of what's contained in their toolbox. And the first thing is modifying your activity. If you can identify the things that hurt, avoid those. Typically that's squatting, kneeling, climbing, those sorts of activities.
Okay, that's pretty self-explanatory. Just use common sense. Next, we've got consistent, appropriate exercise.
That seems contrary to modifying your activity. But with exercise, particularly something like riding a bike or swimming, that movement of the joint will actually serve to keep that joint smooth and lubricated, which will diminish those aches and pains that go along with your usual arthritis.
Okay, and weight management.
Weight management is critical, and it's tough because if you hurt, you don't want to be as active. But we know the biomechanics. If you can lose 5 pounds and you walk 1,000 steps a day, that decreases the load on your knee or your hip joints about 20,000 pounds a day.
Yeah, big
difference.
difference.
So it's huge.
Yeah, okay. Then we've got use of ambulatory aid like a walking stick or cane.
I encourage people when they start to have symptoms, they typically get worse as you increase your activity. And so for women or men who like to go shopping or go walk for walks, using a cane in the hand opposite the side that hurts can significantly diminish the symptoms or the pain associated with arthritis.
Yeah. Okay, and then our last one, use of appropriate medications.
There's a whole boatload of medications out there which we call anti-inflammatories. They don't change the arthritis, but they minimize the body's response to the arthritis, and again will enable you to do a little bit more before you feel like you don't want to do anymore.
Yeah, how soon do you see results after, taking these steps?
It's a gradual process. Probably the most immediate is going to be with the anti-inflammatories, the short-acting anti-inflammatories like Motrin or Advil. You may experience the benefit that day. Weight loss, the hard part is losing the weight, but as soon as you begin to lose the weight and increase your activity, most people report that they actually feel better.
Yeah, all right. Lots of great tips. Thanks so much for joining us this afternoon. If you need any more information about Dr. Rowe and Pierce Community Hospital, definitely head to elementaryyhomepage.net's Premium Health Connection, where we will get you connected.